Hello, this is Catherine Marie Conover, a nurse, and I am doing my video tonight on percussion, a nursing assessment skill. This is my lovely assistant, Sam. And so we're going to be working on percussion. So what percussion is the sound that is created by tapping your finger against your finger. And so you're not hitting the patient, which direct percussion would be tapping directly on the patient. But with most percussion techniques, you're tapping on yourself. And you have to do this firmly. Where you're aiming for is between these two, the knuckle and the nail. And you want to make sure that have a nice firm contact with the patient, because otherwise you're just hitting yourself and you're not getting any diagnostic information. Yeah, stop hitting yourself. It's not going to help. So the reason why we use percussion is because the sound changes with what density is underneath it. And this is used diagnostically for a lot of different things, many times with the abdomen and with the lungs, so that we know what density is underneath there. Otherwise, we wouldn't know. Percussion can be used to prevent the need for an X-ray, which can be costly, and we don't always want to expose people to radiation. It's not so good for them. So this skill is a very important one to develop. Okay, so I'm going to go over the different sounds that are created. So I'm going to place, may I percuss you?
Please.
Okay. Obtaining consent, always very important. All right, so resonance is a sound that's created when you percuss over an area filled with most of the air, like the lungs. Okay, so I'm setting up my fingers so that I'm between the ribs, so that I'm in an intercostal space. Now that's important because I don't want to be percussing the bones, because then that won't give me my resonant sounds. Okay, I'm really hoping the mic is catching that. But it's a very long, hollow sound. Now, something I'm not going to get on her is something called hyperresonance, and that's a very high pressure air, and you'd find that with people with emphysema, or if they're on an abdomen that is very distended with gas. Okay, and then a dull sound is usually over muscle, kidneys. So for instance, this is not where you normally would be percussing, but I'm going to generate the sound. So it's a shorter sound than the resonant, but it is longer than this flat. So I'm on a nice bit of bone here, her shoulder joint where the clavicle and the scapula and her humerus join together. And that's flat. It's a hard surface. And am I hurting you at all?
No.
No. So that's the thing, is I have to hit myself hard enough to produce that sound. So this is why your nails need to be trimmed. But the flat sound is shorter than the dull, but they are very similar wavelengths. Okay, and then the last sound that you're going to hear is called timpani, and this is over liquids. I'm just going to adjust this down a little bit because this is where you're going to find it is on the abdomen. Okay, so you can hear that that's a little bit different than this. More hollow. It's a little bit of a shorter sound versus this. Even shorter. So if you think about the wavelengths of sound, the resonance has really the widest ones. And then as you go down as you increase in density, the wavelengths of sound go down. So obviously over air, you're going to have the widest sounds, and then over bone, which is very dense, very hard, you're going to have a very short wave. Okay? I hope that helps. my suggestion, as always, is to practice your skills as much as possible, because practice makes progress. You're finding friends, percussing tables, percussing. I love to percuss oranges as a practice, because you're not going to get any better at it unless you practice it. And this is a very underutilized skill that gives you a lot of data. So if you have any questions, please feel free to comment and I'll answer them the best I can. Thank you.